I understand that deep cyclical despair that feels utterly inescapable. But what if I told you that premenstrual dysphoric disorder is not a hormonal imbalance, but a severe diagnosable brain sensitivity to completely normal hormonal shifts? This condition, now classified as a depressive disorder, affects up to 8% of women, yet its true biological nature remains widely misunderstood, leaving millions feeling isolated and unheard. To understand PMDD, we must look at the brain's chemistry. During the luteal phase, the 2 weeks before your period, progesterone levels rise and then fall. A key metabolite of progesterone, called allopregnanolone, typically has a calming effect by interacting with GABA receptors, your brain's primary braking system. However, as Johns Hopkins Medicine research highlights, in women with PMDD, this system appears to have a paradoxical response. Instead of calm, the fluctuations can trigger anxiety, irritability, and profound sadness. The story doesn't end with brain chemistry. These same hormonal shifts can provoke a significant inflammatory response. Think of it as a low-grade fire throughout the body and, crucially, the brain. Inflammatory markers, known as cytokines, can cross the blood-brain barrier and directly impact the neural circuits that regulate mood. This is why you may experience physical symptoms like joint pain and fatigue alongside the emotional turmoil. It's a systemic reaction, not just a psychological one. Knowing this, we can see that the solution isn't about fighting our hormones, but about building resilience within our neuroinflammatory systems. The path forward involves a sophisticated, multifaceted approach that provides our bodies with the precise tools needed to navigate these cyclical changes smoothly. We will focus on 3 core pillars: targeted nutrition to stabilise neurotransmitters, specific botanicals to support hormonal pathways, and strategic lifestyle shifts to mitigate the stress response. This is your precise actionable protocol beginning tomorrow. First, nutritional intervention. You must ensure a daily intake of 1,200 milligrams of dietary calcium, particularly during the luteal phase. This is not arbitrary. Calcium plays a direct role in the synthesis and release of mood-regulating neurotransmitters. This equates to 3 glasses of fortified almond milk, or 1 serving of firm tofu and a large portion of kale. Simultaneously, incorporate 300 to 400 milligrams of magnesium glycinate before bed. Magnesium is critical for calming the nervous system as it enhances the sensitivity of your GABA receptors, making your brain's natural brakes more effective. Second, supplementation. Consider chasteberry or Vitex agnus castus. Clinical evidence suggests it helps modulate dopamine and normalize prolactin levels, which can become dysregulated in the luteal phase. A standardized extract is key. Third, the luteal deload. In the 7 to 10 days before your period, you must strategically reduce physiological stress. This means swapping high-intensity interval training for restorative yoga or long walks in nature. High cortisol from intense exercise competes for the same receptors as progesterone, exacerbating the hormonal shift's impact. By consciously deloading, you preserve your progesterone's calming influence and lower the inflammatory burden, giving your brain the stable environment it needs to thrive.